Hello, this is Zambia, Shannon, and Beverly reporting on major and minor neurocognitive disorders. It is the decreased mental function due to a medical disease other than a psychiatric illness. It is also the result of trauma to the skull and to the brain. Major and minor neurocognitive disorders have two categories, major and minor. Major disorders interfere with the person's everyday activity, whereas minor neurocognitive disorders do not interfere with the person's independence. However, the person may need some accommodations throughout the day to be able to function properly. Some of these neurocognitive disorders are temporary and some are permanent. The three that we will discuss today are Alzheimer's, delirium, and concussion. Alzheimer's disease means people have problems with memory, thinking, and behavior, and this is often caused by genetics, lifestyle, and environment over time. Alzheimer's is a form of dementia. Alzheimer's has no cure. People often experience vision loss, have trouble making decisions, and difficulty solving problems, as well as difficulty recognizing friends and family members. Delirium. Delirium is confused thinking and reduced awareness of environment. It can be caused by chronic illness, medication, infection, and even alcohol and drug withdrawal. Delirium is a curable disease. People have memory loss, decreased short-term memory, frequent mood changes, anxiety, depression, fear, and they are suspicious. The last neurocognitive disorder we will discuss are concussions. Concussions are injury by direct or indirect hit to the body or to the head. It causes the brain to shift or shake inside of the skull. It also causes chemical changes. People mostly get concussions during sports such as soccer, baseball, football, and any sport that is contact. Having a concussion reduces a person's reaction time. Therefore, the person should not return to normal activity until they have been released by their doctor. Thank you. Hope you enjoy our presentation.